Good morning. Thank you so much for joining to discuss the changing future of healthcare investments. My name is L.A. Gallion. I'm with Brentwood Capital Advisors out of Nashville, Tennessee. We're a healthcare and healthcare IT investment bank founded in 1989. I'm your moderator today, and thrilled to be joined by Sri Mani and Ben Scruggs of Chartis and Hatteras. They both bring unique perspectives that I know you'll find interesting and thought-provoking. There are a few things I'd like for the audience to take away from today's discussion. Healthcare is a large and growing part of the U.S. economy. COVID has changed the game and accelerated many trends that were already afoot within the system. Investors continue to view healthcare favorably. What are the favorable sectors? Where should you look? What can you and your organization do to adapt and thrive in a growing and dynamic marketplace? One of my favorite quotes is Wayne Gretzky said, "Skate to where the puck is going, not to where it's been." Hopefully that sounds like a good plan. So if we're good with that, let's get started and with panel introductions and dive into conversation. Ben and Sri, I'll start with Ben. Would love for you to give your background and overview of your firm and where you all focus.
Thanks, LA. It's great to be here. Excited to have this conversation. I'm Ben Scruggs. I'm a principal at Hatteras Venture Partners. We're an early stage venture firm based in Durham, North Carolina, where we focus on all aspects of healthcare. That includes therapeutics, medical devices, diagnostics, healthcare IT, and tools. Our firm's been around for 21 years, and we're currently investing out of our sixth fund. As I mentioned, we're an early stage firm. What that means for us is we invest in seed and Series A deals. We support those early stage companies. You usually support them through the life cycle of their company. I tend to gravitate toward our therapeutics efforts. I'm a research scientist by training. I did a PhD in cell biology, followed that up with a postdoc in genomics. Been on the team at Hatteras for about 5 years now, and look forward to discussing the sector.
Great. Anything for the audience to understand, what are you typically investing in your deals? Tell me about the fund size so the audience kind of knows the scope.
Yeah, absolutely. So our current fund is around $150 million vehicle. Initial check sizes can range anywhere from 1 to 5 million, depending on stage and which sector they're in. We're always reserving capital to follow on our investments, as I mentioned. And that's pretty much been our mandate and the style that we've used for the past few years.
Got it. Thank you. Sri, you're a reform banker, and so you made the wise choice to get out of our industry. But would love for you to give your background at Goldman. A lot of folks may remember you from previous panels, and what you're focused on at Chartis.
Great. Good morning, everyone. Thanks, Alec, for the introduction. A little bit unique in my background. I've been both a management consultant and an investment banker across healthcare services, having worked in hospitals, health systems, physician groups, managed care, PBM, all that segment of healthcare services, which we'll be talking about on this panel today. I recently rejoined the Chartis Group after spending 13 years at Goldman Sachs. At the Chartis Group, which is the nation's largest independent healthcare advisory firm focused on healthcare services, I'm focused on the PE sector and on strategy for healthcare service businesses. And within the PE sector, really trying to help them rethink through their valuation thesis, get prepared for diligence, think about how to fine tune those assets they have. And as they think about exit, what advice and services can we offer them to get prepared for that? We'll be talking about that experience, my Goldman Sachs experience, and just any views on the market I have today for you all. Looking forward to today's discussion.
Sri, how would you think about being on the other side from the sponsors versus now being kind of helping them think through strategy? What's kind of been something you've learned from that process? Learning how the buyers think maybe versus selling them things.
When you're selling them things, you're really focused on sort of 2 or 3 things, right? It's how fast can they close, what's the number, and the commitment towards capital committed to actually close the deal. Those are really the 3 things, right? When you're on the other side of the table and you're really trying to help them think through value, you're really getting a detailed look under the hood. You really get to understand how they're thinking about their valuation thesis, where they see it going, what they see the challenges are, more importantly, and some of those are things we're going to talk about today. And more importantly, how they think about this is going to have an impact in healthcare. And I think that's something that, we all oftentimes look at the for-profit space and the not-for-profit space and wonder why do organizations make the moves that they're making today? And hope we could shed a little bit of light on that in the discussion today, that this isn't always all about the bottom line. This is oftentimes about trying to make a difference in healthcare across the country.
Well said. Well, with that, with introductions, we'll move on to, we'll start kind of macro view and kind of drill down to some of the things I think the audience will want to hear about. But if you think about, and sometimes it's good to refresh yourself on this, healthcare continues to grow faster than the broader economy. Now sits at 18% of GDP. The Medicare Trust Fund will be exhausted by 2025. I think everyone reads the Wall Street Journal, and federal debt's at 28 trillion. We've got some new packages that Congress and the Senate want to pass, so that'll grow a little bit more. So if you think about a healthcare organization, a health system, a physician practice, a diagnostic company, how can that group continue to grow and innovate in an environment with the following features? Falling reimbursement, rising taxes, rising inflation. I think one of the things we see across our clients, patients are paying a higher percentage of their healthcare bills through deductibles, HSA plans. You can't read the paper without seeing bankruptcies as a part of the healthcare system. And then I think another issue we want to talk about today is access to the healthcare system continues to be a challenge for minorities in this country. So Sri, I'll start with you here. What is your kind of macro view of the healthcare market, given some of these dynamics that are at play?
Yeah, first of all, the framing of that, LA, was great. So there's a lot of, countervailing forces in healthcare today that are really driven by a macro economy. The question is this sustainable? Is this path that we're on something that we can support? And this is a dialogue that happens every year in, year out. Mm-hmm. But with healthcare now being 18% of GDP, for those of us who've been in this for a long time, we remember when it was like 8-9% GDP. And even people asking the same question then. But since that time, we've seen the dialogue, come toward bending the cost curve in so many different modes, whether and it comes in different euphemisms, value-based care, can we take costs of the healthcare system? And what we've seen is a lot of bite-sized efforts of that. Some of it's being done by the feds via Medicare demonstration projects, things of that nature. We've seen a lot of for-profit models come into play. Some of them actually even now publicly traded, who are trying to figure out how to reduce the cost of care and extract value out of the healthcare system. And we see amongst the not-for-profits as well. The hard part is it's always been bite-sized. And I think oftentimes a lot of the new market entrants are layering on new costs, but the legacy costs that we want taken out just aren't happening, or they're not happening quick enough. And that's what continues to drive this, larger percentage of GDP where healthcare is coming. So the question is, how do you actually create scarcity? How do you actually make parties feel like, well, we've got all these different experiments going on, now we need to scale them? And I don't have a great answer for that, but I think honestly, the largest payer in the country has to step up and start pushing that harder. And that's the federal government. As a source of Medicare and Medicaid dollars, they've dipped their toes into sort of value-based care, utilization management. They've got to start forcing tough decisions in rationalizing care. And I think what we'll find is a lot of the big insurers and care providers across the country will follow suit, from the Uniteds down to the healthcare system. And I think that's the way this is really going to have to begin to pivot. And that'll start to drive value being created by all these companies that have been created over the past couple of years, because it's going to signal the government is very serious. Historically, they've dipped their toes in, they've laid out a thesis, they've had a value proposition, they put out a program, there's been parties participating, but it's never been scaled. They've never forced the scale. And I think once they force the scale, we'll start to see that response.
Well, and I think fundamentally, you think about the healthcare broadly, doesn't matter if it's the U.S. or other countries. How do we kind of manage patients, keep them healthy versus treating them only when they're the most acute? And that's the way the system has been set up today. But we're not really incentivizing the frontline workers. The primary care doctors get paid very little, and it should be the opposite. We should be trying to, and so. And kind of in that lens, as far as efficiency and someone driving, quality outcomes, what examples can you cite where a healthcare organization has innovated or collaborated or partnered to really better serve? Because I always think this may sound simplistic, but when you walk in the Apple store it has a certain customer experience that is, very high end. And I think people don't have that experience within healthcare. And so maybe for the audience, cite some examples where you've seen people maybe move the needle a little bit on those fronts.
I think that's a great question, and it's hard to find a lot of material examples, but I think there's a lot of small ones that are going to be scaled. And I'll give an example of one, which is Kaiser Permanente and Mayo Clinic. They jointly purchased a majority interest in a company called Medically Home. And if we think about care and how care is provided today, 90+% of it's happening in the hospital setting or a physician's office or some other hospital setting or care setting that's not in the home. But I think COVID has taught us that we really need to rethink that, right? Because not only can we deliver care in a more cost-effective way, but bringing people into an inpatient setting exposes them to other issues or health, possible health issues that we don't want to expose the elderly or the children or anybody, right? So I think the fact that Kaiser and Mayo jointly purchasing an interest in this sort of a business, and there's other parties involved that could benefit from this, and given their network and their scale, can really start to begin to move that cost curve down that I was talking about before, but more importantly, bring care closer to home. There's another example, which I'll give, Humana, which is one of the largest government payers out there, second only to the feds, right? They have a large Medicare Advantage population in certain states like Florida. They partnered with Welsh Carson Anderson Stowe, which is one of the largest private equity firms out there, with a $600 million commitment to help them put up clinics in certain populations to take care of the senior population. But the thing I really appreciated about it was Humana could have said to themselves, we're only going to do this for Humana's population. It's actually payer agnostic. If you're United, Blue Cross, whatever payer you are, as long as they have a contract, you can go there. And I always think of Humana as being one of the premier payers with clinical pathways for the senior population. So hopefully that amongst the MA population, Medicare Advantage population, will help create some scale for them in those markets and prove as a good project which they can actually leverage to other states. So I think innovation's happening. Again, earlier, I think it's in bite sizes. It's got to be forced to get larger, and I think that can only happen through economic incentives that are put on from the federal government.
Well said. Yeah, that Humana deal in Florida was super interesting. And then I think you hit another topic that I want to pick Ben's brain on. So, I think the elephant in the room in any discussion about the economy is COVID and what impact it's had. It's disrupted society. It's impacted our nation's health, hospitals, health systems. I think we can all talk about, deaths, mental health, staffing, and healthcare facilities are all kind of stressed. It's an enormous toll. So Ben, as you think about COVID and how it's impacted markets that Hatteras focuses on, how would what are the silver linings? What are the things we may have learned that have made us more efficient that, maybe COVID's brought to bear?
Yeah, it's certainly been interesting and put our broader market in the spotlight, which has helped accelerate things in many ways. I think Shri really raised some interesting points here about cost efficiencies and getting things out of the clinic. Where can we make changes like that? And I think if there's one place that's really been brought into the spotlight during all of this, it's probably the diagnostic sector. Speaking about all the sectors where we play, at least from our investment perspective, it's definitely in this realm. And when we've seen the laboratory testing market grow steadily over the past 5 years or so, that's been relatively mild growth. I think what we've seen with the need for diagnostic testing during COVID, it's really made this where diagnostics are in vogue again, and that just hasn't been the trend. And I think that's all for the better. We have seen this resurgence, and part of this has been some assistance that we've seen from the government, things like the RADx program, Rapid Acceleration of Diagnostics, being able to provide some non-dilutive capital to innovation in this space. And helping companies to be able to think through how can they use their innovations either to be applicable to COVID or be able to expand upon what they're already developing. And I think where this really helps accelerate things is what's going to help our sector going forward. Things like genetic testing, companion diagnostics, molecular and biomarker testing are all for the broader benefit of clinical development going forward. And I think now we're really stepping on the gas pedal with this. And I think that's a major silver lining that's happened here.
What, how, if you think about the second quarter last year and kind of when the lockdowns happened and the need for testing, what did the diagnostic sector do really well as far as, you think about the testing in this country, people wanted to be higher, but the infrastructure we had built to do that, maybe give an example of some things the diagnostic sector did well, to really scale.
Yeah, I think the ability to leverage multiple forms of testing, looking under the hood here, initially, tests that we could roll out, making sure that we had proper sensitivity and specificity for initial tests, but knowing that the types of tests that we would need long-term are not necessarily the ones that we focused on getting to market first. And for that reason, getting some sort of testing out there is making a big difference, and continuing to evolve and develop that is good. And there's technology that's driving that and will continue to be built upon beyond the current situation.
Got it. Kind of a quick follow-up to that. We talked about the multiple testing and diagnostics, but if you go outside of diagnostics and you kind of look at the COVID stress test that's happened in our healthcare system, what are other things that Hatteras or you in particular have noticed that the healthcare system was able to adapt and change quickly, because it was I feel like every week was different, last Q2 and last summer.
Yeah, no question. And I think one of the biggest stress tests for companies that, companies that we focus on had a lot to do with clinical development. There were lots of questions about clinical trials being put on hold or enrollment being slowed down considerably. And early on for those few months, not really knowing what would be done there, how would this affect how capital should be deployed. But since then have really seen that this has led to innovation in the sense of companies being able to think about ways to expand upon current clinical trial designs, seeing more and more in a decentralized clinical trial environment. Companies like Science 37 have really innovated in this space. We have an existing portfolio company called Eligo Health Research that's similarly trying to expand the clinical trials beyond just using these main central nodes that have historically been used over and over again. And so for those reasons, we can make enrollment less expensive and more efficient to get clinical trials up and running and finished in a timely fashion. And I think those types of infrastructure can be beneficial to the health system. Also can bring in a broader diversity of patients, which I think is a really interesting point. We can elaborate on that more as we continue this conversation. But I think that's one additional benefit that we've seen through this.
Sri, a similar, quick, final point on the stress test that COVID did on the system. Any other innovations that you observed, over the last 18 months that were, worth noting? You both have great perspectives on what's kind of, the moving pieces here in the sector.
I think the biggest thing is just the delivery of care virtually. And I think, Ben sort of touched upon this when he talked about the diagnostics, but I think a large part of the healthcare delivery system, while there was some infrastructure around virtual delivery of care, it was not robust. Mm-hmm. I can remember last spring and summer talking to CEOs and CFOs of health systems who would say, we had 1,000 visits per month previously. Now we're at, 20,000 a month, having to scale that up really fast. But it isn't just technology, right? You got to get the people in the right places.
Yeah.
You got to figure out the regulatory environment to go through. And I actually took that as a positive because it spoke to the ability of the healthcare system at large to innovate very quickly. And I think one of the criticisms of healthcare is it does not innovate quickly.
Right.
So it shows when you really have to act fast to deliver your service, you can find a way to do it. So I really take that as being one of the more positives of coming out of COVID. But on the flip side, I think we also saw a lot of challenges for different segments of healthcare, right? Ella, you might have seen this in Ben, like last summer and in spring, a lot of healthcare service businesses were honestly out of business. And not in the most literal sense, but things like dentistry, derm, segments of healthcare that were honestly elective, people are completely shying away from. Come, Q3, Q4, 2020, people were returning back to going to the hospital, going to different segments of healthcare, but it wasn't really clear what was going to happen to a lot of those businesses. In Q1, Q2, 2022, it feels like we've returned back. And hospitals, health systems, physicians' offices, urgent care, ASC, whatever segment you're talking about, has figured out how to navigate COVID, navigate how to keep patients safe and employees safe. So that speaks to the resilience of the healthcare system post-COVID. And I think a lot of the dialogue we're having now, whether it's health systems or sponsors, is around diversification. So I think a lot of folks realize that when they looked at the insurers who had both care delivery and an insurance side of the business, that they weren't hit as bad financially because they had still monies coming in. And I'm being really to think through, how do I think about my existence post-COVID? What did I learn from it? What's my new thesis about how care is going to be delivered in the future? And how can I start skating towards that and building the capabilities and resources to support that thesis?
Yeah, well said. And I think one of the things we'll talk about here in the next couple of minutes is, I think healthcare providers have learned to look past their four walls. It's not just here's our facility, it's here's our platform. Here's how we can deliver care in our communities. And I think that's an important acceleration that happened in this last 18 months. So I think we'll pivot to specific sectors. Ben mentioned diagnostics, but like with any part of the economy, there'll be winners and losers, and healthcare is no different. COVID accelerated trends that were already afoot in the segment. Technology, care delivery systems should bring efficiencies. But again, I think this is another macro point. Healthcare costs are forecast to grow 5.5% annually from 19 to 2028. This is absolutely unsustainable. It continues to be a larger part of employers and patients' wallets/spends. And so, Ben, I'd start with you. Where have you seen interesting businesses in healthcare over the last 18 months? What themes have been guiding, the Hatteras team, as you've been in this environment?
Yeah, one point there about efficiencies in and around the health system has been a big guiding principle for us. And I think, we made the comment earlier. Unfortunately, we've had deaths come into the spotlight here, but a major medical cost is end-of-life care, and know that is a massive cost driver. And so for that reason, that is a space that we have thought about is managing end-of-life care, and ways that we can use things like tech-enabled services to be able to do better care planning for things like that, and bring up those conversations, which are difficult conversations to have, but there are ways to increase efficiencies there. And other things that we've thought about are transport in and around, going beyond the four walls of the hospital system. There are just so many inefficiencies in the system, and transport being one of those. And there are many players that are working in that space, but that's something where we've seen a lot happening. And so a space that we've been paying attention to as well. So I think these types of tech-enabled efficiencies are something that we're really excited about.
Sri, same question. As your work at Chartis and previously at Goldman, in the last 18 months, what are I think Ben's got a great lens for him. It's very interesting that they're looking at end-of-life care and transport because of their DNA is so well known in the diagnostics and pharmaceutical spaces. But what are some other interesting things? You mentioned Humana, but some other interesting businesses you've seen this last 18 months that might be interesting to the audience?
I think, Ellie, you commented earlier on the four walls of the hospital, right? And I think we've begun to see that really change amongst the health systems out there. And I think there's two great examples of it. I think the first is what HCA did earlier this year, where they bought Senior Brookdale Living, which is a home health and hospice business. And we also saw LifePoint as well step into that space. And I guess the question is, what were they thinking when LifePoint bought Kindred, the post-acute? What were they thinking there? Because we think of these businesses as being for-profit hospital operating companies. That's been their bread and butter for years. And I mean, people who've been in this business long enough, and I'm not one of them, but if you remember when HCA had an insurance business to it, clearly divested that and just been in a growth mode in hospital services. But I think what they're doing is they're beginning to pivot to say we need to own more of the continuum of care.
Yeah.
And what do I mean by that? It's when a patient comes in the hospital, knowing where they're going to go after the hospital setting, or possible bypassing the hospital setting and going to another part of the continuum of care because their acuity is low enough that they can go to what we might call the post-acute space. And why is that important? This goes back to what we were talking about at the beginning of the dialogue, which is how does the health system promote health and wellness? How does it promote taking risk among care providers? So if a person has only so much healthcare dollars they can spend, it's how do we place them in the right settings so the right level of care can be delivered at the right time. And then I think is sort of the thesis that HCA and LifePoint are beginning to lay out. I don't think this is the end of their moves. I think we're going to see a lot more amongst this. So I think that's kind of what we're beginning to see is hospital systems begin to think outside of those four walls. What are the other pieces that are adjacent to them that they can own? Are those going to be good business for the VM? And how do they grow? And I think those are two great examples of that moving forward.
You hit a couple of, and Ben hit it with end of life care. You hit home based care, and I would ask you both this question. So we see a lot of care delivered in the home. We see a lot of, especially in this environment, wouldn't be surprising. Behavioral mental health had supply demand imbalances before COVID, and now it's just a complete mess. So as investors, and both of you, please chime in. Sri, maybe I'll start with you. But like as you think about an investment thesis, around care in the home or around mental health in this country, what do you hear from investors of why those are so attractive?
Well, let's talk about mental health for a minute. It's always been known that the mental health population is underserved. Unfortunately, the economics of supporting that prior to COVID hadn't really been there, whether it's from the commercial insurers or the government payers. And that still persists today. But I think there's a growing view that has to be addressed if we expect the economy to heal itself, social fabrics to mend. So you're seeing a lot of both for-profit and not-for-profit parties trying to figure out how to invest in that space. But within mental health, there's tons of different segments of it, right? There's eating disorders. There's it's things that are caused by homelessness. We can come up. The list can keep going on and on and on. Drug and substance abuse. Where people plant a flag is going to be different, and I think it's going to be really different depending on how you want to influence healthcare. We've seen amongst the pediatric population a growing need for mental health services. And I've been reading and talking to a few parties who are trying to figure out how to get into that space. But I think that's kind of the thesis that they'd always an underserved population before. The monies might not be obvious today where it's going to come from, but we're betting where there's growing demand and increasing knowledge as to the issues of what they are. The federal government or the corporate community will try to figure to step up on how to support that. And hopefully there'll be value to be created by different parties in servicing those needs.
Ben, anything to add?
Yeah, I'd love to expand on mental health just because this is a critically important space going forward from here. And I think there's a really interesting intersection between pharma and diagnostics here. A major problem in this space historically has been just a large placebo effect for a lot of these spaces. But I think, going back to the diagnostic aspect, we're really seeing a tipping point in terms of new biomarkers for all sorts of neuro indications. And being able to leverage that and apply that to mental health could really tip the scales and open possibilities for new innovation in the pharma sector. And I'm really optimistic that we'll see that. And for all the reasons that Sri just highlighted here, I think that this will be a space where we see a lot of people spending more time and attention, and we'll probably see more development here and pharma companies hopefully adding this to their pipelines.
Yeah, look, I think anybody in the audience or on this panel can attest that this has been a trying time, on people and society in general. And so, in kind of my working life, just notice that people are just in general on edge, and we are not built. We are not built to live in caves and not socialize with people. And so, there's been a lot of this has been really hard on people, and I think it's exacerbated a trend that was already there. And to Sri's point, we want to treat it, but the payers have yet to kind of come up with payment models that really compensate for it. So that's why the need is not there. I think I read over 60% of psychiatrists in this country do not take insurance, for that very reason. So we've got to be able to fix that, because it has a tremendous impact on communities and families and work. Lastly, in this section, before we jump to the capital markets, which I think people will be shocked on, but to both of you, I guess I'll start with Sri and let Ben jump in. But if you were on the board of a not-for-profit health system in your community, or a community-based system, what would you be advising them to consider? What should a very large health system think about as they think about not just this year, not just what's going on this month, but 3 and 5 years from now? Because I do feel like there's a lot of change in the system. It's dynamic. So Sri, I'll start with you, and then Ben, I'll let you answer that question.
Yeah, I think they shouldn't fall prey to status quo bias, meaning that they've come out of COVID. They have obviously some issues around staffing and things like that, but thinking that the health system is healed. What they really should be thinking, boards, executive teams, is what do I need to thrive for the next 10 years? I'm a mission-based company, I don't pay taxes. What are the assets I need to put around my system to help me grow? You can look at the LifePoint HCA as examples of that, being anything out, building out a care continuum. But I also, on the flip side, I think hospitals have always focused on the 4 walls and trying to own all the 4 walls. Can they look at things that they have within the system? Maybe it's imaging, maybe it's dialysis, maybe it's physician groups that they own, and say, are there parties out there that can operate this better than I can? Why do I need to own this? Can I think like the Welsh Carson Humana deal, where I found 2 best of breed parties to work together for the benefit of the community? And they should really start looking inwardly and asking, am I the best operator of this? Is my capital better deployed somewhere else? And let me find a best of breed partner who has similar values as me, similar growth trajectory, and think about how to leverage that. And I think we're going to see a lot more of that as boards start to say, we've learned through COVID that we're really good at certain things and not so good at other things. And those things we're not so good at, let's try to find someone else that can help us, because we are a mission-centric business. We need to put our mission ahead of all else. And to your point, Ellie, earlier, we don't need to own the 4 walls. And hopefully that theme will continue moving.
Ben?
Not a whole lot to add to that. I think that those are excellent points. I think being able to think about what can be brought within the system, tech-enabled efficiencies, services that help all of this be more cost-effective, and looking outside. I think thinking of that in the bigger picture will be beneficial to these systems. That's all I can contribute to this beyond what Sri said.
Well, great. Well, let's pivot to the capital markets in this country. I think a lot of folks listening in will be surprised. So just a couple of stats, and then I'm gonna let Ben kind of talk about what he sees. But private equity in this country has today 1.9 trillion of dry powder. Again, almost $2 trillion that's ready to be spent. The Dow, S&P, and NASDAQ are up 76, 75, and 95% from March of 20 to March of 21. There have been 739 IPOs this year through August. That eclipsed the previous record of 480 last year. That was a full year. Global M&A volumes hit a new record in 21, and again through August of 3.6 trillion, eclipsing last year's record of 3.59 trillion. The U.S. was 2.1 trillion of that volume. Healthcare and technology, and the marriage you'll hear in some of this, you've heard a lot of tech-enabled and a lot of ways to help the provider extend their reach. But healthcare and tech were the two of the most active sectors in the U.S. M&A this last year. In the second quarter, healthcare M&A activity was 127 billion, driven in large part to digital health. Ben, I think for people who don't do what you and I and Sri do every day, this would seem to be a paradox, right? The market, COVID's come back, the Delta variant, it's last year was a shutdown quarter. You would think that would diminish investor appetite. What do you make of stock performance, M&A volume, and liquidity and dry powder chasing these markets?
Yeah, it sounds frothy, right? When you put all those numbers on it. I think early on, certainly there was a bit of a pause, and then since then the markets have just been off to the races. I think maybe a place to start when thinking about this is that M&A is really a fundamental driver of our sector, and I think about that particularly from the pharma and medtech sides of the business, just in terms of these companies have largely removed their R&D within the organization, and they rely on smaller companies to be able to feed their pipelines. So that's a fundamental aspect of what's happening within healthcare, why there is reason to believe that there will be continued M&A going forward. Certainly the robustness of the capital markets that we've seen lately, it's had a trickle-down effect to the earliest stages where I operate, in terms of more firms have been able to raise larger and larger funds with more and more dry powder. For that reason, there is more capital to deploy than there ever has been before. It's also causing more capital to be needed to be put to work faster than it has been in the past. That could be one reason to believe this may not be sustainable, but for the near term, in terms of years, there will be capital to probably be able to sustain this for a while. And those firms that have more capital to deploy, they can also help support their companies for longer. And that's important because at some point, if the tide changes here and we see something where there is a cycle in the market, which we all know at some point we would expect there to be some sort of change, the companies can be supported through the private side before they have to go to anything in the public markets. So I think for that reason, we're also seeing a lot of new innovation. And beyond just some of the sectors that we've highlighted so far, there are reasons to be really captivated by what's happening in healthcare right now. On the pharma side, we have new modalities like cell and gene therapy, RNA therapeutics are something that we've all heard about now. And there's a lot that will continue to happen in those spaces. And what's important about those is that we can better address a broader patient population through these new types of technologies. And seeing more capital be put to work in those spaces, there's reason to be excited about that. So, for this reason, I think, there will be a cycle in the market at some point, but there's still a lot of promise and opportunity that's out there.
Well, you hit on a topic that I want Sri to opine on. So you both have seen cycles, you both have seen recessions, and there will be a time, right? So right now, lots of healthcare companies are getting calls from investors or interest. There was a time when you can't give businesses away, right? When things are really hard. So Sri, two points. One, I think kind of dovetailing off Ben's comments of what's driving this record, deal flow, and then kind of how long, which is a little bit of a loaded question, do these, M&A environments usually last?
I wish I knew the answer, but I'll give you a couple of theories, anecdotes. When I was thinking back about 21, it's been a remarkable year in the public markets for disruptive, what quote unquote disruptive businesses. You had companies that had only been in existence 4 or 5 years, which in theory had disruptive business models. I'm thinking like Agilon and Privia, next generation physician MSO models. You had new insurers popping up with Scale, Oscar, Clover, Alignment Health. And then you had other parties that were sort of just taking advantage of what was going on, telehealth businesses, right? And then you had your real innovators. A company called InnovAge always sticks out in my mind. Taken public by Welsh Carson. It was in the PACE business. No one had ever heard of PACE 2 years ago. And this is really a high acuity dual eligibles business. So all of a sudden you saw all these innovators coming to market. And I guess what I'm really getting at here is where someone has a great story to tell about innovation and how care can be delivered in a new and more promising way. There's money there to be had, whether it's in the public markets or in the private markets. And I think that's kind of the story that we've seen over the past year. I think it's been supercharged by really low treasury rates or borrowing rates, money coming in from the Fed supporting the economy. And I think, as you said earlier, LA, almost $2 trillion of dry powder. All of that's sort of driven this innovation, right? But in the backdrop, like, what can really happen here? What can slow the party down? And I think we're starting to see the elements of it. I think the Delta variant has caused the economy to slow down. All the numbers seem to suggest that employment hiring is slowing down. We're starting to see the economy slow down month over month. That's the sort of big bugaboo that hangs out in the corner. And I think last week we saw the federal government put out a new proposal for tax reform. And tax reform affects, how investors think about putting their money to work. And we might see dollars that we might have thought coming to healthcare go into another sector of the economy, or just might be pulled out, period. And that $2 trillion of dry powder drops by a certain percentage. That's how you sort of see the music stop. The other piece is, we start to see a real pivot or change in regulation coming from the federal government, which makes certain segments really attractive and certain segments less attractive. And that's how we could see dollars shift. And when dollars shift, dollars oftentimes leave the cycle. So I think those are sort of things that I think when I think about what's been driving this innovation, this drive for consolidation, this drive for IPOs and M&A activity over the past couple of years. And it all started in 2017. I shouldn't say it started in 2017. It got some extra juice in 2017 with that tax reform act. So obviously we'd love to see the cycle keep going. I think it's healthy for the economy to come out strong, but there are some serious headwinds to be dealt with.
Got it. Well, we got about 5 minutes left. So I'm gonna shift us to a couple of things and some kind of parting comments from both of you. Obviously, hopefully the audience has learned that the market is rapidly changing. I think COVID has affected some of that change. There's an abundance of capital, which may be shocking, and these types of markets don't last forever. But then, as you think about the future of healthcare and what an organization can contemplate as far as strategy, this may sound like a silly question, but is the status quo, is doing nothing a mistake in today's environment?
Well, I think it can be, and the reason is, for some of these outstanding macro influences that could have a major impact on us, there are opportunities that are in front of us today in terms of what is available, and from that perspective, trying to take advantage while the opportunity exists is something that should certainly be contemplated by most organizations. It may not be appropriate at this time, but advice that we give to most of our companies is sometimes the best time to raise capital is when you don't need it. And so that is the type of environment that we exist in right now. Of course, there are caveats to that and what needs to be considered. But I think right now, while there's something to be considered, we need to be thinking multiple years out for all organizations.
And Sri, I think we've discussed a lot of partnerships, interesting new models, collaborations. But I think this question is, what does a a company, organization, or a system need to be mindful or thoughtful about with these opportunities they have at hand, right? We've talked about stuff moving outside of the four walls of a facility. And you both have hit a lot of really interesting points, but what would you tell, some folks in the audience or some organizations that they have a lot of opportunity, how should they think about their strategy over the next, not just 1 year, but long term?
Yeah, I'm going to say something which might surprise you, but I think they need to think about their employees. And COVID, obviously, we're all very familiar with the stresses that COVID has put on caregivers, physicians, nurses, techs, front desk staff, everybody that supports care delivery. And we're running into a shortage of them, right? Many have walked away from wanting to serve because of, the stress they've been under or the fears of getting sick. And change is hard. COVID was an unfortunate change to how they did their day job. And as CEOs, senior executives, and HR departments look at morphing their business model, it requires change and support of the employees to be successful. Change cannot happen without employees pivoting along with it. And I think we have to be careful or mindful of too much change too fast that isn't bringing the employees along. Because if you don't have them pivoting with the healthcare system, we might find the best strategies, the best solutions out there become unexecutable. And I think that's one of the biggest sort of unspoken risks right now is how do we rebuild the workforce that supports healthcare delivery in this country? And I just think that should be top of mind for all boards and management as they think forward.
We've heard that from clients, over the years. Like if you take care of your employees, they'll take care of your clients and your customers. And so I think it's well said that those folks, especially in the healthcare system and facilities, have been stressed to the nth degree. Final question for both of you. I'm going to let Ben start and Sri kind of weigh in. We've got about a minute left. So with all this available capital, what's a segment of the healthcare system that deserves some attention and investment that maybe has been ignored for too long? So Ben, I'll let you weigh in, and then Sri can jump in, and then we'll conclude.
Yeah, we have touched on mental health already, but I'll just reiterate that quickly. We need more innovation in that space. And I think the other one are disparities in healthcare. And I think one of the comments that I made earlier about where we've been looking for innovation is decentralizing clinical trials. And I think this is one way that we're thinking about it, but expanding the represented populations in clinical trials, getting them access to healthcare. This is a really big problem, and there are many facets to how we need to think about working with it. So I think where I have seen the most interesting ideas that might be actionable would be in representing broader populations through clinical trials. So I'm really hopeful that will just be a tipping point that we get to start to see more diversity among healthcare.
Sri?
Just building off of Ben's comment there, I think it addresses our disparities, really comes to how we think about working with rural healthcare, non-urban markets. This conference is really targeting folks in the Southeast, and preponderance of the Southeast is rural. And a preponderance of them don't have access to healthcare like we do in Atlanta or Nashville or Raleigh-Durham. And we really need to figure out how to bridge that divide, not just to address COVID, but to address Ben's point about getting broader participation in clinical trials, bringing the health and wellness up of the country. And I think rural healthcare should be one of the next areas of focus for capital deployment, for growth and innovation.
Well, thank you both. This has been a riveting conversation. You've both been great perspectives to the healthcare marketplace. It is a changing place, but there's a lot of good. But we can also do better as a healthcare system and community supporting different parts of the population in more efficient ways. Because I think there's a lot of stress with COVID that's hit this system, but a lot of good things have come out of it. So thank you both. With that, we're adjourned, and we appreciate everyone listening in to this panel discussion for Health Connect South. Thank you.